Hello and welcome to session 2 for GCSE, Health and Social Care and Childcare. This revision session is for the single award, which is 1 GCSE, and for Unit 1. WJEC have set the examination date for this series, which is on the 20th of May 2024, and this exam will contribute 40% to your final qualification. This evening's session will look at how genetic inheritance affects our health and well-being, diet and hydration, breastfeeding, exercise, play, short and long-term conditions, disability, housing conditions, the availability of services, and air pollution. So this evening's session is generally based on factors that can contribute towards the health and well-being of an individual. Okay, the first thing that we're going to look at tonight is genetic inheritance. So this could be questioned through what we can inherit through our physical characteristics, things like eye colour, height, body shape, nose shape and nostrils. So sometimes you will hear somebody remark on maybe your appearance and how similar you are to your mum and dad, and these are therefore our physical characteristics. Also, individuals can inherit certain medical conditions from their parents. These then are referred to as genetic or inherited disorders. Now, there are a number of genetic and inherited disorders, but obviously what we need to understand is what they entail and also how they will affect an individual's ability perhaps to perform day-to-day activities, their intellectual perhaps barriers, and also emotional and social barriers related to these different disorders. In WJEC's resource book, there are information on a variety of disorders. These are Fragile X syndrome, cystic fibrosis, muscular dystrophy, Huntington's disease, Hunter's syndrome, haemophilia, thalassemia, and sickle cell anemia. When I deliver this in my classroom, I show students a series of videos, and the videos then will demonstrate an understanding on what each condition or disorder actually entails, and a real life scenario of how this affects someone's ability to perform day-to-day activities. So after this session today, you could obviously Google these disorders yourself to gain a better understanding of them. Tonight, I'm just going to run through a few definitions for you. So this will give you the basics of what each disorder entails. So the first one we're going to look at tonight is the Fragile X syndrome. This condition can cause a variety of physical, behavioural and developmental problems. Patients may have learning difficulties, autistic traits, anxiety and shyness, and poor muscular strength, along with any other signs and symptoms. This is usually quite hard to identify and diagnose initially, and obviously the individual then has to perform a number of tests just so this diagnosis is correct. The second one then is cystic fibrosis, perhaps one that's a little bit more common than the Fragile X syndrome with students. This is where a buildup of mucus occurs in the lungs and the digestive system, and the patients then have a recurrent perhaps of chest infections and find it difficult to gain weight and grow. Often individuals will have a cough, a constant cough, where obviously the mucus is forming within the lungs, and part of their treatment then, their daily treatment, is that they have to bring up this mucus just to allow the lungs to become clear, and breathing obviously is easier. And also there's a large amount of medication that needs to be taken on a daily basis. Somebody then who has muscular dystrophy, this unfortunately is something where the muscles waste and it deteriorates over time. There are several different types of the disease, but the most common one is the Duchenne muscular dystrophy, which mainly affects boys. Individuals are normally born with the ability to move and function as normal, and then as the muscles waste, their movements progressively deteriorate, and in most cases then they are bound to a wheelchair. Number 4 then, Huntington's disease. So Huntington disease is a condition that stops part of the brain from working. This usually only occurs within patients between 30 and 50 years of age. So an individual who up until this age has led a normal life, and then their brain function starts to deteriorate, and this then will also affect their body movements because signals are not being transmitted from the brain as appropriately as they can be. And unfortunately then, this is usually fatal after a period of about 20 years from receiving that initial diagnosis. Individuals will have speech problems as well as movement problems, and obviously cannot make decisions for themselves. Number 5 then is Hunter's syndrome. Hunter's syndrome is a metabolic disorder that does not show signs of symptoms until maybe 2 to 4 years of age. These individuals have abnormal bone growth. They may have a large head, and this is why the percentile chart is used as one of the growth measurements, and also a protruding tongue and slower development of speech and walking. The 6th one then is haemophilia. So obviously this is the ability to clot, and usually only affects boys. Patients will suffer more from bleeds, nosebleeds and sores, and because of this then their blood is thinner within the body, and they will bleed out a lot quicker than an individual who doesn't suffer from haemophilia. Obviously that we need clotting agents within our blood, and this is something that doesn't happen then with individuals who suffer from haemophilia. Thalassemia then is the 7th one, and this affects the red blood cells and causing anemia, which can lead to be very tired, shortness of breath and palpitations. And this is because then a crisis happens within the blood network, and blood is not distributed effectively throughout the body. And the 8th one then, sickle cell anemia. This is a serious blood condition that mainly affects people from African or Asian, Middle Eastern and Central European descent. Patients with this condition are at greater risk of developing serious infections just because of the abnormality that is formed within the cells. Okay, so maybe a question that could be delivered to yourself in the summer would be to recognise an inherited condition and then the effects of this condition on an individual. So that's why you need to have the bank of understanding of the different conditions, and also then how this can affect someone's life. Okay, so next tonight we're going to talk about diet, and obviously how a diet can affect our body and lives in a positive manner and also in a negative manner. So basically, what are the benefits of a healthy diet? Okay, so if we're looking at the physical benefits of a healthy diet, we of course have more energy. We're in a better mood emotionally. We can maintain a healthy weight, and our sleep quality is of a better quality. We have clear skin, and also long term we have less likelihood of suffering from a health condition such as heart disease, stroke and cancer. What we also need to understand is the importance of hydration and how hydration can be beneficial to us. Obviously, when we live our normal lives, we need to rehydrate by drinking water. And why? Because it can prevent the mouth from becoming dry, which can cause bad breath. We have better cardiovascular health just because the blood can be pushed around the body more efficiently. It can help regulate our body temperature and also lubricate the muscles and joints from perhaps suffering injury, and also moving then more efficiently. And also we can then clear waste from our body more efficiently. Okay, so you need to gain confidence on the importance of diet and obviously the importance of hydration. Maybe a bubble chart diagram would help you here, and then the vision could obviously be condensed slightly. Okay, so state the advantages and disadvantages of breastfeeding. So we could look at this in terms of, are we concentrating on the mother or are we concentrating on the baby? Okay, first of all, we will look at the advantages of breastfeeding on both. Okay, so here we have an anagram, Dr. Blockis. Okay, the D being the baby is less likely to be of risk of diarrhea and vomiting. Sorry, G at the end. The baby then is less likely to have nappy rash. So that was my R, or eczema. The B being to help bond between mother and baby. L, baby is less likely to have leukemia when they develop into childhood. My O then is the less risk of being obese. My C then is for less risk of developing cardiovascular disease as an adult when the baby grows up. Less risk also for mum to get breast cancer. Okay, so the both cancers there. Okay, less risk of infection, and also reduce the risk of SIDS. Now, maybe something that you could just reflect on very quickly is obviously the antibodies within the breast milk will help the baby fight bacteria in a more effective manner. Okay, and also you could say that it's readily available if obviously mum has established a solid feeding routine, and also that they don't have to fuss in terms of sterilising bottles, and the breast milk is at the correct temperature for the baby to take on. Unfortunately, okay, we have to look at the disadvantages of breastfeeding, and here I have the code of MICE Street. Okay, so it can be difficult for mum and baby to master the technique of breastfeeding. Your baby may have problems with latching, and mum maybe not be producing enough milk. The father is unable to experience the same intimacy with the child, as obviously the mum has greater responsibility of feeding the baby. It can be a challenge for both mother and baby, especially if mother is recovering from perhaps surgery to deliver the baby, or obviously is very tired due to the commitments. She can be feeling quite embarrassed about this, especially perhaps in front of male relatives and when she's going out into public places. Mum also needs to consider her diet and what she drinks, as obviously whatever she takes on board herself is effectively delivered to the baby within a couple of hours and days. And also society can be quite critical of breastfeeding in public, and mum has less time to herself, as she is obviously needing to feed the baby every hour and can't perhaps go back to work and do activities that she would like to do because obviously the baby needs caring for. The benefits on exercise then on physical health, okay. Obviously, if this question was to arise, it would perhaps state a life stage in terms of, is this an adolescent, is this for an adult, or is it for later adulthood? But in general, I think these are appropriate benefits of exercise on our physical health. So this is, there's less risk of obviously developing conditions, long-term conditions. There's less risk of health problems. We can have healthier organs. Our bones are obviously more dense, and hopefully our joints are healthier because of the physical exercise. We can maintain a healthier weight, and also we have more energy, and we can sleep better because our body is tired and we're needing that rest a lot more than if we didn't exercise. The mental health benefits then of exercise, there's less stress involved because you have that downtime to yourself to release and to escape perhaps from responsibilities of day-to-day life. You can think in a more productive and clearer way. You have better self-confidence, reduce the risk of depression, and also there's less anxiety and better mood in general. Now we're looking at the social and emotional benefits of exercise. So socially, you could obviously say that you're spending better quality time with your friends. You're in an environment where you will be meeting new people and have new friends, and you can broaden your interpersonal relationships. And also you feel part of a group and a belonging, and perhaps you will contribute positively to your community. And most importantly is it's time for you to relax, have fun and enjoy, and obviously follow a different focus within life and just take your mind generally off your worries and problems. So bearing in mind the past 3 slides then, what I've got for you now is an examination question on how we can assess your understanding of how exercise benefits individuals. So Bethan has been selected to compete in a cycling event at the Commonwealth Games. Her father, David, is a keen cyclist, and he taught Bethan to ride a bike when she was 5 years old. They went on cycle rides every weekend and during holidays. They spent a lot of time together when she was growing up. Explain the positive effects of cycling on David's health and well-being. Okay. So in this question now, we need to think of a clear structure. Do you have enough content to allow you to explore different avenues on the positive effects of cycling on David's health and well-being? And perhaps what I would encourage students to do is, okay, can we think of the physical benefits of David's health if he was to obviously cycle? So what we'll be looking at here is he would obviously have an increase in his fitness levels. He can be maintaining a healthy weight, and hopefully then he would avoid suffering from chronic problems in the long term. Okay. You could say then that there are also intellectual benefits on David's health and well-being. So this being that he has time to escape and he can clear his mind. He's having fresh air, and his way of thinking then is more productive. He can perform better in his workplace, or perhaps perform better at home with tasks that he has to accomplish. He's learning about bike repair and bike maintenance, and also learning about the rules of the highway code. And obviously these are benefits to him, and which will obviously have an emotional benefit on him then. So maybe he has better self-esteem because he's more confident with the rules of the highway code. Maybe he's repaired his bike following a puncture, and he feels that he's accomplished something in a positive way. He feels successful. He's happy because he's got something to look forward to, and he knows he's going to spend some quality time with Bethan. It reduces his stress levels and also gives him a different direction and focus or goal in life. And obviously then, in terms of David's social well-being, he's got the opportunity to mix with others. He can establish new friendship groups. He can perhaps spend quality time with his existing friends. And also he gets to spend quality time with his daughter, okay, which is obviously a massive benefit to him. So again, before perhaps answering a question like this, I perhaps in the margins or just above the question, I would just make sure that I have enough content, and obviously this will allow me then to explain myself in a clear manner, and I've covered a variety of pathways rather than just looking at, say, the physical benefits only. Okay. Okay, next tonight then, we're going to look at play. Okay, so obviously play amongst babies, amongst children, and to a certain degree, early adolescence. Okay, so obviously play is essential to the development of babies and children, and this is encouraged from birth. Why? Because it contributes to their intellectual, physical, social, and emotional well-being. Play helps promote brain development and learning within babies and toddlers. It will give them a variety of skills in terms of how to solve problems, how to cooperate with others, how to have perseverance and resilience, how to overcome challenges, and also obviously have benefits in terms of physical benefits by reducing cardiovascular disease, diabetes and obesity, if the level of play then is obviously vigorous enough for the individual. We can obviously play outdoors, okay, and normally playing outdoors is referred to perhaps movements then which will affect our gross motor skills, so being larger muscles of the body, okay, so maybe we would be going to the park, we would be using a variety of different apparatus, we may be cycling, we could be going to the forestry, we could be making dens, we could be running, playing tag, hide and seek, etc. Okay, so if we are playing outdoors, obviously there should be an improvement on our cardiovascular health. Okay, we're out of breath, we've got the heart distributing our blood around the body and beating more efficiently, and also we've got a higher heart rate. This will obviously contribute us to gaining or maintaining our healthy weight. It will improve our gross motor skills, kicking, riding a bike, throwing objects, balancing, things like that, and also improve our self-confidence and develop joint movement. Now, what's important perhaps for us to be able to recognise is different activities. So I've mentioned a few, and this could also be perhaps going to the beach, we're playing rounders, we've got a trampoline outside in the garden, and we're going to the park, perhaps we're going for a little walk around the lake, etc. Okay. Normally then playing indoors is classified perhaps as something that we're doing in a classroom or in a small environment where obviously bigger movements cannot occur so naturally. So think of this in terms of maybe you're sitting by a table, or you have a variety of specialist tools to use. For example, DIY, we may have beads where you'll be threading beads and making bracelets and necklaces, maybe it'll be painting and playing in the sand, etc. So the main benefits of this type of play then is that perhaps we use our brain a little bit more to make decisions. Perhaps we've got lots of problems to solve. Perhaps we've got jigsaw puzzles, different colours and patterns to fit into different shapes and sizes. Also then we're looking at developing our fine motor skills. So these are obviously the movements with our smaller muscles, for example, picking items up, stacking them, putting jigsaw shapes together, maybe holding a nail before I hammer it into a piece of wood. And obviously then this promotes mental health in terms is active, I'm making decisions, I need to remember perhaps pieces of information, and also then resilience in terms of maybe I can't solve the problem initially, but I can come back to this problem when perhaps I've gained a little bit more knowledge or understanding in terms of what I'm doing. Okay, so just make sure here you're happy with both types of play, and obviously you can give valid examples and then explain how this can benefit children and babies. Okay, so there are a variety of long and short-term conditions within the specification from WJC. These are all listed on the slide here. So short-term illnesses from food poisoning, perhaps having a rash, fever, cough and cold, chickenpox, measles. So these are the type of illnesses that only occur very suddenly and also will disappear within maybe a couple of days, and it's just limiting us slightly just for a couple of days only. Okay, We've also then, fortunately, got more long-term conditions, and this is long-lasting, okay, and can worsen or deteriorate over time. Okay, so examples of these then are obesity, Crohn's disease, diabetes, heart disease, arthritis, dementia, and cancer. Now, what is perhaps likely to appear as a question are things like, do you understand the short and long-term conditions? So with each of those bullet points that are green and blue, do you understand them? And also then, would you be confident in knowing how these short and long-term conditions can affect an individual? Okay. So again, this could be maybe a grid in terms of all the short-term illnesses, what each illness means, and then the effects that these illnesses can have on the individuals. Okay, it's definitely worth obviously knowing the difference between which ones are short, which ones are long, and if I was to suffer from these, how this would affect me. Okay. You also need to understand the support that's needed if obviously then I was to suffer from these conditions. Okay. So hopefully you would have looked at different types of disability within the classroom. There are 3 different types of disability. Okay, so the first one that we're going to revise tonight is sensory disability. So this is where perhaps we have a problem with our vision, our hearing, our smell, our touch, and obviously our taste buds. There's a number of different conditions that would be considered to be a sensory disability. Okay, so perhaps we're visually impaired and we have a hearing impairment, or we are diagnosed with autism. Okay. A physical disability is probably the most common disability. However, obviously, there are 3 types of disabilities, and this is why we need to be aware of all of them. A physical disability is obviously something that affects someone's physical ability or mobility. Okay, this can happen perhaps because of an accident that somebody has suffered, but also could be something that an individual is born with or is obviously genetic. And some examples of these are cerebral palsy, spina bifida, and then dwarfism. And the last type of disability then tonight that we're going to look at is learning disabilities. Okay, and these obviously affect an individual on how they learn new things. It can be mild, moderate, or severe, and obviously does depend on what learning disability an individual has. So yes, you need to understand there are 3 types of disabilities, and also appreciate how these types of abilities can affect each individual differently. Okay, so environmental factors then is something else that we're going to look at today. Now on the slide that you see in front of you, there's obviously housing conditions to consider, the availability of health and social care and childcare services, and air pollution. So these 3 topics are classified as environmental factors. Okay, so we're going to look first of all at housing condition, and if we were to live in a poor quality of housing, how this could affect us. Okay, so obviously we're more likely to have poor health, and maybe the house is not insulated and there's not enough heat in there. Okay, maybe we haven't got fresh flowing water. Okay, so this can lead to a variety of different health problems. Maybe there's a variety also, maybe there are domestic violence within the house. Just because obviously people are a little perhaps more aggressive towards each other because they're unhappy, they don't feel safe in the environment that they live, so people are falling out with each other a little bit more. We can also have poor diet because we live in a poor quality of house, just because obviously the financial resources are not there to perhaps have the correct cooking utensils or cooking equipment, and therefore then we're just buying perhaps meals that we can put in a microwave and they're readily then available to eat in maybe a couple of minutes. Obviously, there could be infectious diseases just because of poor hygiene within the house. We could live in sorrow, okay, and always be unhappy. We could be feeling very overly anxious about our situation because we can't feel as if we can escape or improve our quality of housing. And maybe there's more risks of accidents happening. Maybe the house is overcrowded. Maybe the surfaces are not deemed safe for babies and young children. We could perhaps have a lot of misconduct within the area that we live, okay, and perhaps a lot of social problems. Our education might suffer because obviously I have more illness, and also perhaps I don't have enough resources in the house, for example, internet, Chromebook or computer for me to be able to study. I could have sleeping problems, which obviously is going to affect my education as well. I have fewer opportunities because the money that we do have perhaps has to be spent on the gas and the electricity rather than the nice things within life. Sorry, just going back to that slide. So we just need to be aware of, just because of perhaps where we live in terms of our house, how this can affect ourselves in terms of how I feel about myself, also possibly our social opportunities. Okay, we will look at a question later on in tonight's session for you to be able to apply this to an examination question. Okay, so the availability of health and care services. This means, are our health and care services easy for people to access and use? Okay, so in the majority of cases, individuals will find it easy just to pick up the phone, maybe travel to their GP surgery, travel to their local hospital, and they won't have an issue. However, some individuals who perhaps don't drive, who are dependent on maybe family members or neighbours to take them to places, also struggle perhaps with booking online appointments, maybe using the telephone because they have a hearing problem, etc. Okay. Obviously, if we have access to health and social care services, here then we could perhaps alleviate our problems in terms of illnesses, injuries and pain, and then we can continue to live a normal life in a quick manner compared to people perhaps who can't access these services. Okay, if I'm prevented from accessing these services, normally then my obviously problems will deteriorate and worsen over time. The aim then of social care services is to improve an individual's quality of life and to help them to reach their potential. This obviously involves perhaps things with how they're finding their lives difficult on a daily basis. We need to listen to their problems and also then encourage them to perhaps take responsibility, socially interact with people, and to attend activities which will improve their social well-being. Okay, so the effects then of air pollution on the individual. Okay, so if we looked at this in terms of maybe I live near a factory, maybe I live very close to a busy occupied road, okay, then the likelihood is that I will suffer from a number of respiratory diseases, and also then this will obviously affect my ability and lung function. Maybe I have a constant cough, maybe I'm suffering from asthma, maybe I have problems with my nose, and obviously secretion. The oxygen that's within my body perhaps is polluted also, okay? Maybe I am inhaling, okay, this into my respiratory system, which then effectively is going into my bloodstream. And this then is where I can suffer from cardiovascular diseases. I'm very tired, okay, if there's a lot of air pollution, maybe it means there's a lot of noise, okay, there's a lot of congestion within the house, there's fumes constantly, and this can lead obviously to tiredness, headaches, and then worry just because I know I'm not resting, I'm perhaps not performing as well in school, it's affecting my job and my relationship with others. It's damaging the nervous system, okay, and the ability perhaps for my brain to function correctly. Maybe I've got constant itching of the eyes, nose and throat. And unfortunately, this can lead then to damage to the reproductive organs and essentially liver damage. Okay, so we need to understand that obviously living next door to the factory or the busy road can have a number of effects on an individual. Okay, so this is the examination question. Now, the first part of it is obviously related to the fact that we live next door to a factory. And then the second part then will look at the contributing factors that can affect a child's intellectual development. So first of all, living near a factory affects sleeping patterns of many families. Discuss how living near a factory affects the health and well-being of individuals. Okay, so we have 5 marks here. Now, what I'd be looking for is, can you give me a variety of answers and discuss the answers, and also look at possibly positive things in terms of, can living next door to a factory help me at all? Okay, so if we looked at the questions that we have here, okay, what I would be expecting to see is obviously there's a number of health problems that could occur because of living next door to the factory. Maybe I have problems with my breathing, a constant cough, maybe tight chest, and I have asthma. I've got the itchy eyes, I can't sleep as well. It's very dangerous, especially if I have a young family, in terms of the amount of traffic that is in the area coming back and forth to the factory. There's constant worry then because of this traffic. My children are not spending a lot of time outside because of the worry of anything happening to them. I could feel quite sad and isolated because of where I live, and this is preventing me as a family perhaps for going out and doing things together. I can become quite frustrated where I live. Socially then, there's perhaps not much to do in the area because everyone's deciding to stay inside and close their windows. But also this could be a positive thing in terms of there's jobs in the area and there's less poverty then, because people are obviously having the jobs to attend and they're happy to be in this environment. So even though the next question is part of from the first question, a lot of my pupils within the class have misunderstood this, and they're kind of sticking onto the same theme as the first question. So what we need to do here, we need to discuss factors other than sleep that will affect a child's intellectual development. Now, this has nothing to do with the fact that we're living next door to the factory. And this is where a number of my pupils perhaps were misled in terms of the question. Okay, so what I told them to do was, right, okay, if we're talking about a child's intellectual development, what can contribute to that in a positive or negative manner? Okay, so they then thought about it again and they came back with valid answers, and they then started to, sorry, I'm going the wrong way. They then started to think of, okay, so if I didn't go to school, that would affect my intellectual development. That's great, we're on the right wavelength now. So if I was ill, okay, not because I live next door to the factory, but just because I had an illness, okay, and my attendance level was less than expected, this would obviously have an effect on my child's development, on my development, okay. My presence in school, okay, so maybe I was late, okay, every Monday, every Tuesday, I missed the same maths lessons, missed the same Welsh lessons, and this obviously then would have a knock-on effect on my child's intellectual development. If my attitude wasn't ready, okay, and I wasn't ready to learn, I wouldn't take on perhaps as much information. Maybe there's no support at home, okay, and rather than reading with mum and dad when we went home, rather than completing our homework tasks at home, I didn't get to do that, so obviously my intellectual development would be slightly hindered. Maybe we didn't have resources in terms of the internet, a Chromebook, some pens, books. I never went to the library, okay. My opportunities perhaps were less than others, and then that's why perhaps others progressed within this class and I didn't, because I wasn't exposed to different experiences. I was never taken to the museums, I never travelled, I never learned about food and culture and things like that. Okay, and also possibly parents don't value education, and their attitude towards education was that it doesn't matter, and there wasn't an emphasis on obviously doing well at school to enable individuals to have better jobs at the end of GCSEs, A levels. Okay, so we need to make sure there that we fully understood that question, and it was nothing to do with the factory. It was just, can you tell me and discuss these factors that can affect a child's development other than sleep? Okay. So thanks for attending the second session this evening. The next section obviously is going to look at further factors that contribute towards our health and well-being, and also then the early intervention programs that are in place and how they can assist our health and well-being. Thank you.